So today we're going to talk a little bit about commitment and passion and people and principles and how they've sort of guided my life. But I really wanted to start with you're doing the very first step of what is a really core principle in my life, and that's continuous learning. So your willingness to come here, your willingness to do some stuff that you haven't done before, meet people that you haven't met before, challenge yourself, because I have always found in my crises, I learn a lot more, and I've learned more from bad behavior than good behavior. So it's very difficult to learn from a great boss, because a great boss is doing stuff seamlessly, and you can't really see into their mind and understand how they're doing it. But you can really learn from somebody who you see and say, oh, that doesn't work. And so I've really had the privilege to work with a vast group of different people. As you heard, I was active duty military for 29 years, came in right after the Vietnam War. It was a time of really incredible transition in the military. We went from drafts to a completely volunteer military. And I want to just say, having been at the Walter Reed and at Ground Zero for many of the stressors that our post-Vietnam soldiers were in, we didn't really welcome them home well. And those soldiers still live without today. So I think we've learned that lesson, and we've been much better with our soldiers and sailors and airmen. But I can also tell you at that time, there were not very many women in the room. Now, fortunately, I grew up with 2 older brothers, so I knew how to deal with you all a little bit. But I will tell you, I had daughters. So I am not very much aware of young men. Now, my second husband, I'm remarried now, got married 3 months before COVID hit. He raised 2 boys, and he said, oh, you just be direct. So I'm going to be direct today with you in what I have to say. So the number one principle is continuing to learn and pushing yourself beyond your boundaries to where you're uncomfortable. And you'll see how I've done that kind of several times in my life. My second big lesson was learning from the people who disagree with you. Now, that's always uncomfortable for us. But I have learned a lot from people who may not share my world viewpoint in that moment. And I learned a lot during COVID. And I learned a lot about how we interpret things in an easy way rather than a hard way. And I'm relying on you all and the Gen Zs of the world to see the big picture. What do I mean by that? About every month, the New York Times or the Washington Post writes up about how Republican counties are dying from COVID more than Democratic counties. But what that really is, if you really look at the data, is Republican counties are rural counties. Republican counties have lost primary care. They've lost hospitals. And so during that original outbreak of COVID in early 2020, yes, Republican counties, rural counties, and urban county Americans were dying at the same rate. But as soon as there became tools available, whether it was testing or treatment or vaccines, there was less access in Republican counties. And so when people got up and said, grandparents, go to your local CVS or Walgreens, and there isn't anything in that town except a dollar store, that's telling those people that you have no idea how they live, that you don't understand their community, their environment. And so that's my second big thing for you. Don't rely on what people are telling you or what's on paper. Get out there and actually experience it. And it's why I went on the road. About 3 months in, I got to 44 states, talked to many, many governors and mayors, but met with community. And so I could come back to the White House and say, do you know that closest hospital in Elko, Nevada is in Idaho or Utah? 150 miles away. Now, if you're really sick, I think you probably heard of golden hour. If you're really sick, that golden hour is way beyond your grasp. And so if you actually look at the data across America, the rural counties have been dying at higher rates from every disease, from cancer to diabetes to heart disease for the last decade and a half. So there's a structural problem. It's not how people voted. It's the reality that they live with every day on the ground that they have to deal with. Now, my second biggest principle is get past yourself. Now, I get into my comfort zone. I was in my comfort zone in the military, believe it or not. I found the military to be an incredible place where people's viewpoints could be heard, whether it was science or medicine, and you could express your opinion and leadership would listen. Now, they wouldn't always agree with you, but they would at least hear me and see me and hear what I had to say. So I was used to that. I had grown up in that system. It's kind of like growing up in your family with your friends, and I was comfortable there. And I got this call because President Bush had launched what we call the President's Emergency Plan for AIDS Relief. He decided that 15 to 20% of everyone in sub-Saharan Africa shouldn't die. And although everybody else was talking about what a tragedy it was and how many people were dying, no one was doing anything. They were talking about it at the UN. Kofi Annan was saying this is terrible, HIV is terrible, but no one acted. And President Bush said, we're Americans, we care for people no matter where they are in the globe, and we're going to do something. And your parents' taxpayer dollars, and those of you who work, your dollars, go to this program that has now saved in less than 20 years, 25 million lives. And that's what's possible when someone has a vision. I was in the Department of Defense, and I was working in Africa since 1998, and there wasn't treatment. And at home, I had treatment for my patients, and in Africa, I had nothing. And wheelbarrow loads of moms and dads were brought to the hospital and children dying, and nothing could be done. Now remember, in the United States, we were saving people. Everybody who got on drugs by 1996 to treat HIV, many are alive today, and yet all of Africa was dying. 20 to 30 to 40% of adults were already HIV positive. And so I was passionate about doing science, but I was passionate of understanding what the community needed. And I couldn't build $5 million labs and ignore the fact that parents and children were dying in the community. And so when PEPFAR was announced, I got on a plane from Kenya, flew back with my 400-page PowerPoint. You say, why was it so long? Because I didn't know how long it was going to convince the White House that the DoD should be part of PEPFAR. Because people don't think of the Army when it comes to public health. And so I wore them down, and we became part of PEPFAR. And shockingly enough, the military knows how to jump over barriers. We don't let anything get in our way. We're used to implementing. We're used to getting through and over and around and figuring out stuff that works. And so within that first 6 months, we had a lot of people on treatment. So I get this call, and they say, we need you to run the CDC's program. Now, the CDC's program is in Atlanta. I'm kind of a Northeast kind of gal. I didn't want to go to the South, didn't want to go to Atlanta. My family is in Washington. But in the end, I said no, and I said no, and I said no, and in the end, I went. And why was that inflection point so important? Because when you get comfortable in a situation, you don't really know if the leadership and management skills that you've learned will translate to someplace else with a different culture, a different way of looking at things, a different part of the world. You have to really push yourself into that place and see if it does work or learn what does work. Because once you can kind of create that roadmap of this is what you do when you go into a new situation, and this is how you work within a different culture, you don't learn it. It's not something that's in a textbook. And so I went, and from that then became people calling me during the Obama administration and saying, would I run the whole PEPFAR program for the country, which is $6 billion a year and thousands of people all over the globe. And I said yes, because that was back in Washington. So 9 years in Atlanta, came back to Washington, and was in Africa getting them ready for COVID in January and February of 2020. Assuming that the United States was getting ready for COVID. We weren't. Africa was. So I started getting these calls of, what are you doing? How come you're getting prepared? What are you seeing that we're not seeing? From the one person I knew in the White House, whose name was Matt Pottinger. And so I was writing to him about what I was seeing, what I saw in China, the fact that I thought that this was spread very rapidly, that there were a lot of asymptomatic, that means people without symptoms spreading the virus. And so you couldn't track it by people who got sick. By that time, it was too late. You had to find the people before they got sick. And so I'm sending these messages back to the White House. And throughout the middle of February onward, while I'm in Johannesburg, they're calling me and saying, come back to the White House. I saw senior military leaders go into that White House, people much more accomplished than me, much greater leadership skills than me, and leave. And I got worried, and I said no. I'd never met anybody in the White House. I didn't know anybody in the White House. I didn't want to go to the White House. I was very comfortable where I was. But I could see that tsunami wave of COVID washing over the United States, and I knew how deadly it was going to be. And that gets to my point. If you see something and you can do something, you sort of have to. And that's sort of what you're trained with every day. That doesn't change. It doesn't change if you're 20 or 30 or 40 or 50 or 60 or 70. If you see those things, you really need to act. So I came back to the White House. General Milley, who was the Joint Chiefs, was incredibly supportive. And I was able to navigate behind the scenes, things that you couldn't see. And I will say that the real advantage that that White House had, that all the other White Houses that I worked in did not have, is they believed in the private sector. And so when I came back that first week and said, we got to meet with the groups that can make vaccines and the groups that can make treatments and the groups that can make tests, because we're way behind, they brought them all into the White House. And within 3 weeks, we had tests for every single type of equipment that was present in the United States. This is the stuff that doesn't get talked about. But this is the greatness of America, is we can see a problem and solve a problem if we unleash our creativity and innovation together, and we listen to one another and we respect one another to realize that we don't have all the solutions and someone else does, and they can be part of our team, and we all win then. And we won with treatments and vaccines and tests because the private sector came with us. Now, I know you'll have questions, so I'm going to make time for those questions. I only want to tell one more story about the importance of learning from others. So sometimes people have a perception of certain states or certain governors or certain mayors. I can tell you, as I traveled the country, I found every governor, of the 44 I met with, really concerned about the people in their state. And more importantly, knew the people of their state and knew what would work with them. So in this state, in West Virginia, when I came here, Governor Jim Justice had assembled this team who he knew. He was like, no one's going to think of West Virginia. We're always an afterthought. We're almost all rural counties where population is not so high. The cities are going to suck up all the resources, like New York City and Chicago and Detroit. And so we have to figure this out on our own. So he was making hand sanitizer and visors and masking and had a plan, and all of his people were working together long before the federal government engaged. And it was Jim Justice when I said to the governors in December, the vaccines really need to get to the elderly because they still remain our most vulnerable population. And at the beginning of the pandemic, we lost 30% of the elderly over 70 who were diagnosed with COVID. Now, admittedly, we didn't have very many tests. But even when we had tests, the death rates among people over 70, your grandparents, your great aunts, was 10%. So we were losing a lot of people. I knew they were the ones that had to get vaccinated. So I got Jim Justice on a call with all the other governors. And he said to the governors, age, age, age. Vaccinate by age. Start out with your most vulnerable group, go to the next most vulnerable group, and the next most vulnerable group. Now, that makes common sense, right? But there was a whole other group that said, no, we're going to immunize all the hospital personnel first, the 20-somethings, the 30-somethings. And those states did not have a plan to really get to the elderly first. But Jim Justice did. I was trying to explain mitigation to people. It's really hard to ask people to change behaviors. But Governor Ivey in Alabama said, okay, this is the way I explain it to my community. I say it's like Swiss cheese. If you do one thing kind of mitigating for your family, it still has a lot of holes. But if you layer on another part of mitigation, let's say you were all getting tested to protect your grandparents from exposure, there's still a lot of holes. So if you add, I'm going to wear a mask when I go see my grandmother, because I could have asymptomatic COVID, you cover up more holes. And if you get a vaccine, almost all the holes are gone. And so it was a great way to explain to community how these tools that we have to be used together, not just by each other. And when I was working with the governors to reopen America, as we worked in April to do with guidelines, Tate Reeves got on a governor's call and said, for my community, governor of Mississippi, said, I explain it to like a light dimmer. So the lights are off, everybody's isolating, and now we're going to turn that light on bit by bit by bit. We're not turning a switch, we're turning the knob. And so I used that all over the country, and it was incredibly helpful. And then I got to Missouri, and the governor there had set up this great meeting with the community, and I was talking to all of the community, and it was about July of 2020, and a woman raised her hand and said, I'm president of Lincoln University, and that's a historically black college and university. And she said, I have a very vulnerable population. I can't get tests. We're out in a rural area. Can you get me tests? I would have never thought about them not having access to tests if she hadn't raised her hand. And we were able then to get tests to every single historic black college and university, because many of those individuals lived at home, many of them lived in multi-generational households, and through testing, they could be in college, but also be confident that they're not bringing the virus home to their grandparents or their elderly. And so these are the things you can learn when you're open. Now, most recently, I said no again. So I haven't learned completely all my own lessons. I'm still learning and growing myself, even at my current age. And in that, a company got in a little bit of trouble. I wrote a report about what I thought should be done. And the next thing I know, they're calling me and saying, can you go to the West Coast and be the CEO? And of course, I said no, because I'd worked really hard to have my daughters near me and the new 3 grandchildren under 5. And I didn't want to be out of my comfort zone. I certainly didn't want to be on the West Coast. Anyone here from the West Coast? It's different culturally. It's a lot of people that exercise a lot. But in the end, I had to say to myself, do you have something that you can offer? Do you think you could help in any way? And then I ended up saying yes. I'm going to end with the thing that I have found most important in every single person I have hired, and that's passion. Now, people will say, find your passion. I'm not going to tell you to find your passion. Your passion will evolve, and you'll find it will be different. It will be different now. It will be different in your 20s. It could be different in your 40s. It doesn't have to be consistent. But what I love to do is hire someone that looks enthusiastic about the job, that's going to bring their positive attitude into the workplace with that can-do attitude and say, I want to be part of the team, and I'm going to help where I can. When I was 14, I started to work at a drive-in, so that can age me. They're back. Drive-ins are back. But I was working in a drive-in, and when you're working at a drive-in, you have to make your own milkshakes to deliver out to the cars. And the head of the restaurant said, Debbie, you can only use 1 scoop of ice cream. And I'm like, are you kidding me? It's like milk then. I'm not going to put milkshake out there for my tips with 1 scoop of ice cream. So I made it with 3 scoops of ice cream, because then it looked like a milkshake that the straw stood up in. And he came to me and he said, I don't like what you're doing, and I should fire you. But you're the only one who looks at the tables inside and refills the salt shakers and the ketchup because you see it needs to be done, and even though it isn't your job, you do it. And so I'm going to let you use 3 scoops of ice cream. So you never know what your positive attitude and your proactive attitude is going to do until you bring that passion to everything that you do, including this week that you're here. And then finally, your final principle that's really been important to me is know where your core comes from. Now, I learned a lot about men while I was working in sub-Saharan Africa because I always like to admit that I'm failing in an area and get someone to help me. Because we were 15 years into PEPFAR and we still were not finding men to get them on treatment. We knew they were out there because we were finding them late, where we couldn't save their lives in the same way if we found them early. And men in Africa were not used to going to the clinic proactively. We have that problem in the United States with men. And so I brought in the private sector, and they did focus groups with men. It was very eye-opening to me, but you probably know this already. They asked the men who they would listen to, and who do they believe at their core cares about them for who they are rather than what they can do for you. Do you know what it was? Moms. Moms. It wasn't girlfriends. It wasn't sisters. It was moms. Well, I knew where the moms were of every man. The moms were in church on Sunday because about 95% of women go to church on Sunday in sub-Saharan Africa. So we went into the churches and we said, moms, I know you want your sons to be healthy. I know you want them to live. We know a lot of them have HIV asymptomatically, undetected, and we want them to thrive. So we're giving you these self-tests. Take them home to your son. And if they're positive, make sure they get into treatment because we can save their lives. We added 2 million men to treatment in 18 months. That's what moms can do. I had daughters. I don't think the daughters would have done that for me. But that's different. When they have their own children, you become relevant again. But there's that period in between where you may not be so relevant in their lives. But a short way of saying, find that core that believes in you for you, because you're going to need that. Because when the insults come, when the social media gets going, when it causes you to question who you are and what you're doing, having that anchor into a bedrock provides that unbelievable solace when you're pushed against the wall. It's what got me through the White House. It got me through all of this swirling news that was out there. And I just want to come back again and say constant learning, compassion for others, and willing to listen. I'm worried as a country, but I know you have the solution because I know you're listening to each other now. And if we can listen to people who don't share our viewpoint, we can continue to grow as a nation, grow as an individual, and see the goodness in others, even if they don't agree with me, because they don't need to. What they need to do is be willing to hear and listen to each other and grow from that experience. That's what I got to do during COVID. It was a privilege to work across this country. It was a privilege for 22 years to work overseas and share the bounty and knowledge of the United States with others to save people's lives. But finally, my hope is on you all, and I'll give you one example of why I believe that, and then we're taking your Q&A. When in our darkest moments, and I was really worried about the baby boomers. Now remember, I said to you, people over 70 in March and April and May were dying at 30% rate. And I don't know if you have baby boomer grandparents, but if your grandparents grew up in the 60s and 70s, we are a little recalcitrant to rules. In fact, when someone gives us a rule, we want to do completely the opposite. And so I knew the baby boomers were not going to listen necessarily to me. So I did YouTube videos for Gen Zs and millennials and pleaded with them to get these mitigation information to their grandparents. And they did. And the reason, yes, we had guidelines that went out, but guidelines mean nothing if they're not implemented. It was that group of individuals who ended up being our voices, talking with their grandparents, and it was also that group that really helped get many of those individuals vaccinated. Because we had talks with them and we said, tell your grandparents you can't sleep, you can't study, you can't work well in college, not knowing they're vaccinated because you're worried for them. Because you have power. As grandchildren, you have remarkable power in swaying people's behavior, and you used it for good. And I will always be grateful because it saved literally millions of Americans from very serious illness from COVID. And to those of you who are over 65 and in the audience, COVID is not gone. Repetitive COVID infections in people over 70 is leading to consequences. You can survive the initial episode, but we end up seeing diabetes, we end up seeing heart attacks, we end up seeing people getting mononucleosis type symptoms that don't go away, and we see long COVID. So please still be careful this fall. If they come out with a new vaccine, get that, but understand Swiss cheese. Layer on that mitigation so you can get through that 6 to 8 weeks and be healthy. So I thank you for letting me come. I thank you for letting me talk about my own personal growth. And thank you for coming here and your leadership interest and your training, and you're willing to go past their comfort zone.